And in fact, way back when chronic fatigue syndrome was first coming out, and it was discovered by Dr. Leahy in Lake Tahoe, in North Lake Tahoe area back in the 1980s, and it was called some of you may remember the yuppie flu and all that kind of stuff, and way back when, all the names it had, and finally it became chronic fatigue and immune deficiency syndrome, CFIDS, and now just chronic fatigue syndrome. One of the things I heard Dr. Leahy speak many, many years ago in the 1990s at a conference, and he was talking about this, and I didn't really understand it at the time because it was all new to me, but later as I understand more about inflammation in the immune system and the central nervous system, what he had learned way back when, that was inflammatory activity that was blocking out the adrenal response. And so this has been known for a long time, but not been commonly known for a long time. And so patients get chronic fatigue because their adrenals can't respond. Now you add that to a patient who somewhere along the line has got adrenal stress and their adrenals are fatigued, and now you've got double jeopardy where the adrenals actually are hypoadrenic and they don't get the message. So now you got a person who just is like wants to lie around in bed all the time. So when inflammatory cytokines are the causes of decreased HPA activity, local and nutritional therapies to the adrenal glands have little or no impact. It's like non-responsive chronic fatigue, and we all have patients like that. So, even the patients who maybe we treat with the adrenals and get a mild response, but they never seem to get over the hump, or they're always showing some signs of adrenal activity, being in need of support, these are the patients you look at the hypothalamus on fire. And so the inflammatory effects on the HPT, hypothalamus, and the HPA axis is associated with chronic fatigue syndrome and fibromyalgia as well. Yes, sir? So the question is, if a patient would do a clinician would order for the patient to do a adrenal salivary index, would there, over 24 hours, would the test be valid if this was the source? Well, yeah, it would be valid, but it would be indicating what was going on with the patient. What you'll see is a patient who says they're tired all the time, and you find adrenals, or you think it's adrenals, and the test, the levels are either like in the normal range or low. You know, I mean, they just tend to be really on the low side, and they just don't come up no matter what you do, or they come up very little. It's not typical we just have a patient who only has the hypothalamus on fire indication for that, and because they probably got there somewhere during the course of time when they got to that position, so the adrenals are probably oftentimes run down too, and we treat them, but they only get to a certain flat level and they can't get beyond it. So what do we have to do? We have to treat the adrenals as we would normally do, but once we get to a certain flat level, we can't go beyond that. Now we have to treat inflammation. So we have to treat inflammation to treat the adrenals. And I'll show you how to do it.